Did you know that 1 in 8 men will develop prostate cancer in their lifetime? And even more shocking, many are speeding up this process during lunch without even realizing it. What's on your plate today could be silently harming your prostate, even if it seems harmless or even healthy. Hi, I'm Dr. Alexander King, a men's health specialist who turns knowledge into a better quality of life. I want to share something important with you. Mike, a 54-year-old patient, came to my office with a serious problem. For months, he ignored clear signs, waking up 3-4 times a night to go to the bathroom, feeling constant pressure on his bladder, a weak urine stream. But like many men, he just shrugged it off and said, "It's just old age, doc." When we finally ran the tests, the diagnosis was tough: advanced prostatic hyperplasia with cells with a high potential to become cancerous. During our conversation, something became clear. The problem was directly related to his diet. Have you ever wondered if what you eat could be harming your prostate? Let me know in the comments if you have any of the symptoms I mentioned. If you're over 40, you may have already felt some urinary discomfort or may be worried about your intimate health, and you have good reason to be. The prostate is a silent gland that rarely gives clear signs until the problem is already advanced. But today, I'm going to reveal something that few doctors talk about: the 5 foods that most harm your prostate, and more importantly, the 5 best natural allies that can protect it and even reverse early problems. Before we move on to the villains and allies of the prostate, let's better understand this gland that is so important for men's health. Many men don't even know where the prostate is located or what its function is in the body. The prostate is a small gland, about the size of a walnut, located just below the bladder, surrounding the urethra, the canal that carries urine and semen out of the body. Its main function is to produce prostatic fluid, a component of semen that nourishes and protects sperm. As we age, it's natural for the prostate to increase in size. This phenomenon, known as benign prostatic hyperplasia, BPH, affects about 50% of men over 50 and more than 80% of men over 80. The problem arises when this growth becomes excessive, or when abnormal cells begin to multiply uncontrollably. It is precisely at this point that our diet plays a crucial role. Certain foods can accelerate inflammatory and hormonal processes that favor both excessive growth of the prostate and the development of cancerous cells. On the other hand, other foods have a protective effect, helping to maintain the health of this vital gland. The 5 prostate villains. Cow's milk naturally contains growth hormones and, even worse, stimulates the production of insulin-like growth factor, IGF-1, which accelerates cell division, including prostate cancer cells. A little discussed aspect is that excess calcium, often consumed through dairy products, is also associated with an increased risk of prostate cancer. Research indicates that men who consume more than 2,000 kilograms of calcium per day, the equivalent of 2 large glasses of milk and some derivatives, have an increased risk of developing aggressive forms of the disease. Casein, the main protein in milk, has also been studied as a possible promoter of inflammation in sensitive tissues, such as the prostate. In laboratory studies, casein has shown the ability to stimulate the growth of prostatic cancer cells. Do you have a habit of consuming a lot of milk or dairy products daily? Think about it. Processed meats, the ham in your sandwich, that sausage at Sunday's barbecue, the bacon for breakfast. All of these foods are packed with nitrites and nitrates, preservatives that turn into N-nitroso compounds in the body. These compounds are potent carcinogens that directly attack the DNA of prostate cells. A study published in the Journal of the National Cancer Institute showed that men who consume processed meats 5 times a week have almost double the risk of developing aggressive prostate cancer. And that's not all. These foods are inflammatory, increasing chronic inflammation in the body, a condition directly linked to abnormal prostatic growth. An important detail: the cooking method also influences. Grilled meats at high temperatures, especially when charred, produce heterocyclic amines and polycyclic aromatic hydrocarbons, both compounds with carcinogenic potential for the prostate. Research from the University of Michigan has shown that men who frequently consume very well done or charred meats have up to a 40% higher risk of developing advanced prostate cancer. Refined sugars, that little treat after lunch, the soda, the white bread, they all contain refined sugars that spike insulin. Elevated insulin levels stimulate the production of IGF-1, creating a perfect environment for uncontrolled prostatic cell growth. In addition, sugar fuels systemic inflammation, compromising your immune system, and its ability to detect and eliminate abnormal cells before they become a bigger problem. An impressive fact, men with type 2 diabetes, often caused by excess sugar, are up to 50% more likely to develop prostatic problems. A rarely discussed aspect is that insulin resistance, a condition often caused by excessive consumption of refined sugars, also affects male hormone levels. This condition can reduce testosterone and increase estrogen, creating a hormonal imbalance that favors abnormal prostatic growth. Studies from the U.S. National Cancer Institute have also found that diets with a high glycemic index, which rapidly raise blood sugar, are associated with a 67% higher risk of developing advanced prostate cancer. Trans fats and refined vegetable oils, margarines, fast food fries, processed cookies, they all contain trans fats and refined vegetable oils that completely unbalance male hormones. These fats interfere with the proper production of testosterone and increase estrogen levels in the male body, a dangerous combination that favors abnormal prostatic growth and inflammation. Research from the University of California has shown that men with diets high in trans fats are up to 75% more likely to develop benign prostatic hyperplasia, BPH, the benign enlargement of the prostate that can evolve into more serious conditions. Refined vegetable oils such as corn, sunflower, and soybean oil, when consumed in excess, are also problematic. Rich in omega-6 fatty acids, these oils can promote the production of inflammatory mediators called prostaglandins, which aggravate prostatic inflammation. The ideal would be to maintain a balanced ratio between omega-6 and omega-3, but the typical Western diet contains up to 20 times more omega-6 than recommended. A study conducted at the University of San Francisco showed that replacing just 5% of calories from saturated fats with healthy fats, such as olive oil and avocado, reduced the risk of prostatic problems by almost 30%. 5. Excessive alcohol. And here is the villain that many consider harmless in small doses: alcohol. Especially beer, which contains phytoestrogens from hops, can increase estrogen levels in the male body. Regular consumption of more than 2 drinks of alcohol per day is associated with increased prostatic volume and elevated PSA, prostate-specific antigen, the most used marker to detect prostate problems. In addition, alcohol dehydrates the body, concentrating urine and further irritating the already inflamed prostate, worsening symptoms such as urgency and urinary frequency. A lesser-known aspect is that alcohol compromises the liver, the organ responsible for metabolizing and eliminating estrogens. A liver overworked by alcohol functions less efficiently, allowing higher levels of estrogen to circulate in the body, potentiating prostatic growth. Research from the Department of Urology at the University of Wisconsin has shown that men who consume more than 50 kilos of alcohol per day, approximately 3 to 34 drinks, have an average prostatic volume 35% larger than abstainers. The same study showed a significant worsening of urinary symptoms after episodes of heavy alcohol consumption. Do you have a habit of drinking regularly? Have you noticed any changes in your urinary habits after consuming alcohol? Share your experience in the comments. The 5 natural prostate allies. But it's not all bad news. There are powerful foods that can not only protect your prostate, but also help reverse early inflammatory processes. Let's get to know them. Studies show that men who regularly consume tomato sauce, cooked or roasted tomatoes, cooking increases the availability of lycopene, have up to 35% less risk of developing prostate cancer. The interesting thing is that lycopene concentrates specifically in prostatic tissue, neutralizing free radicals and reducing local inflammation. 2 servings of tomato sauce per week can already make a significant difference. Watermelon is also an excellent source of this protective nutrient. An important detail: lycopene is fat-soluble, meaning it is best absorbed when consumed with a small amount of healthy fat. Therefore, tomatoes sautéed in olive oil represent a perfect combination to maximize prostatic benefits. Research from the University of Illinois has found that lycopene not only protects prostatic cells against oxidative damage, but can also reduce the expression of genes linked to the proliferation of cancer cells. In a clinical study with men diagnosed with prostate cancer, those who consumed lycopene supplements before surgery had significantly smaller tumors at the time of the operation. Pumpkin seeds. These small seeds are true capsules of prostatic protection. Rich in zinc, an essential mineral for prostatic health, phytosterols, and essential fatty acids, pumpkin seeds help reduce inflammation and improve urinary flow. A study with men with BPH showed that daily consumption of just 10 grams of pumpkin seeds per day for 12 months significantly reduced urinary symptoms and improved quality of life. Add a tablespoon of these seeds to your yogurt, salad, or consume as a snack between meals. A fascinating aspect of pumpkin seeds is that they contain unique compounds called cucurbitacins, which have been shown to inhibit the 5-alpha reductase enzyme, the same enzyme targeted by drugs prescribed for prostatic problems. By naturally inhibiting this enzyme, pumpkin seeds can reduce the conversion of testosterone to DHT, a hormone directly involved in excessive prostatic growth. Hungarian researchers have also found that the oil extracted from pumpkin seeds contains compounds that can modulate the inflammatory response and improve urinary function in men with prostatic hyperplasia. In a clinical study, men who consumed pumpkin seed oil for 6 months reported a 40% reduction in nighttime urinary frequency. Deep-sea fish, salmon, sardines, tuna, and other deep-sea fish are rich in omega-3, essential fatty acids with potent anti-inflammatory action. Omega-3s not only combat prostatic inflammation, but also help balance hormone levels, reducing the conversion of testosterone to DHT, dihydrotestosterone, a hormone directly linked to abnormal prostatic growth. Consuming fatty fish at least twice a week can reduce the risk of aggressive prostate cancer by up to 40%, according to research from the Cancer Research Center in Seattle. DHA and EPA, 2 specific types of omega-3 found in deep-sea fish, have demonstrated in laboratory studies the ability to induce apoptosis, programmed cell death, in prostate cancer cells while preserving normal cells. These fatty acids also help reduce the production of inflammatory mediators such as cyclooxygenases, COX, the target of many anti-inflammatory drugs. Researchers at the University of California have found that men with diets rich in omega-3 have significantly lower levels of inflammatory markers in prostatic tissue compared to men who consume little fish, broccoli, and cruciferous vegetables. Broccoli, kale, cauliflower, and cabbage contain sulforaphane, a compound that stimulates the body's detoxification enzymes and has specific action against prostatic cancer cells. The most incredible thing is that sulforaphane seems to awaken tumor suppressor genes that were dormant, helping the body recognize and eliminate abnormal cells before they form tumors. A British study showed that men who consume more than 3 servings of cruciferous vegetables weekly have a 41% lower risk of developing prostate cancer. Sulforaphane has also demonstrated the ability to interfere with androgen receptor signaling, crucial for the growth of cancerous prostatic cells. In laboratory studies, this compound managed to reduce the expression of prostate-specific antigen, PSA, by up to 86%, suggesting a powerful regulatory effect on prostatic growth. Research from Oregon State University revealed that sulforaphane acts on multiple protective mechanisms simultaneously, It induces apoptosis, reduces inflammation, improves detoxification of carcinogens, and notably can even reverse epigenetic changes that silence tumor suppressor genes. This multi-target action makes cruciferous vegetables one of the most important foods for prostate protection. Do you include these vegetables in your diet regularly? It's worth rethinking your menu. 5. Green tea. Finally, we have green tea, one of the most studied beverages when it comes to prostate protection. Rich in catechins, especially EGCG, epigallocatechin galate, green tea inhibits an enzyme called 5-alpha reductase, involved in abnormal prostatic growth. In addition, EGCG induces programmed death, apoptosis, of prostate cancer cells without affecting healthy cells. Men who consume more than 5 cups of green tea per week are up to 25% less likely to develop prostatic problems, as demonstrated in Asian epidemiological studies. Replacing coffee or other drinks with 2 to 3 cups of green tea per day can be one of the best decisions for your prostatic health. Another notable mechanism of green tea is its ability to block the formation of new blood vessels, angiogenesis, that feed tumors. Studies from the University of Wisconsin have shown that EGCG can reduce the levels of vascular endothelial growth factor, VEGF, a protein that stimulates the formation of new blood vessels, thereby limiting the blood supply to tumor cells. Green tea is also rich in L-theanine, an amino acid that reduces stress and improves sleep quality, both important factors for prostatic health, as elevated levels of cortisol, stress hormone, are associated with worse prognoses in prostate problems. In an intervention study conducted in Japan, men with precancerous lesions in the prostate who consumed green tea extract for a year had a 3 times lower rate of progression to cancer than the placebo group, demonstrating the preventive potential of this beverage. Besides the 5 allies and villains I mentioned, I can't fail to emphasize the importance of adequate hydration for prostatic health. Many men, especially those who already face urinary problems, tend to reduce water intake to avoid frequent trips to the bathroom. This is a big mistake. Adequate water dilutes urine, reducing its concentration and irritation on the urethra and prostate. In addition, good hydration helps eliminate toxins and metabolic products that could contribute to prostatic inflammation. Urological studies demonstrate that well-hydrated men have a lower incidence of urinary tract infections and prostatic inflammations. The ideal is to consume between 2 to 3 quarts of water per day, distributed throughout the day, reducing only in the 2 to 3 hours before bed to minimize the need to get up during the night. Returning to Mike's case, after learning about these villains and allies of the prostate, he implemented significant changes in his diet. He eliminated milk and dairy products, replaced processed meats with fish, drastically reduced sugar, and included pumpkin seeds, cooked tomatoes, and green tea in his routine daily. In just 3 months, urinary symptoms improved considerably. PSA, which was at concerning levels, reduced by 18%. More importantly, follow-up biopsies showed a significant reduction in prostatic inflammation. Today, Mike is 57 years old and leads a normal life without the urinary discomfort that so disturbed him. And it all started with simple but powerful changes in his diet. Men, prostate health doesn't have to be a genetic lottery. What you put on your plate daily can be your greatest ally or your worst enemy in this battle. The choices you make today will determine your quality of life at 50, 60, 70 years. The good news? It's in your hands. Starting today, eliminate or drastically reduce the 5 villains I mentioned and regularly include the 5 natural allies. Your body will thank you, not only your prostate, but your entire circulatory, hormonal, and immune systems. If you are already feeling the warning signs, difficulty urinating, weak stream, need to get up several times during the night, don't wait for the problem to get worse. Combine these dietary changes with a visit to the urologist. Early detection can make all the difference. And if you like this content, be sure to subscribe to the channel. Every week I bring information like this, based on scientific evidence, to help you live longer and better. Share this video with friends and family. It may be exactly the information that someone close to you needs to hear. Remember, taking care of your health is not being fussy, it's being smart. A healthy prostate is synonymous with quality of life, energy, and preserved sexual vitality. Until the next video, this is Dr. Alexander King, always working to transform scientific knowledge into practical health for you.